And you know what's crazy is sometimes patients come in and they say, you know what, I want an all-on-4. And I want the top of the line, 18, 19, 20,000, whatever it is. And we're like, we can save your teeth with the full mouth restoration, and it's going to be 9,000 or 9,800. So it's not, oh, they're doing this because of the money. They're doing this because it's the best treatment for you.
Right. Or sometimes when they have their lower jaw bigger than their upper jaw, right? And they have a cross bite where they bite like this, and they believe that with the full mouth restoration, we can correct what skeletal problems, right?
Yeah, that is just needs to be solved with a surgery.
Sometimes, unfortunately, we have to reject patients because what they're asking is not doesn't match with the reality of what's going on, right? And we're not going to do a procedure that we know it's going to fail.
Hey, welcome back to Supreme Dental Podcast Studio. You can be anywhere else in the world right now, but you're here with us. We appreciate that. Don't forget to like and subscribe. My name is Frank Navarro. My wife and I are the owners of Supreme Dental Clinic. We come with a phone number with an email address. You can let us know exactly what you think. If there's anything you guys want us to speak about, concerns, questions, remember this podcast has been for you, the patients. And today we have two of our doctors here at Supreme Dental and Cosmetic Center. We have Dr. Joel. And we have Dr. Elias.
Hello, Frank.
So one of the main things that I want to talk about this time about, because we've hit many different topics, but I want to talk about expectations versus reality, because that is a big issue that I believe we get here at the clinic when somebody's expecting something because they've seen it in social media, because their friends told them about it, because they spent 25 minutes in Google and now they're dentists. So I want to talk to you guys a little bit about that, and I want to see if you guys can give me, to start, some of the different things that you guys have experienced of expectations versus reality here at the clinic.
Right. I think one of the first things that we see is, as you mentioned, that people do their own diagnosis, and because they've seen a video on YouTube or Instagram or Facebook, they're like, well, I need crowns, right? Or I need veneers, which is the most common one, right? But not everybody's a candidate for that. So they come down with that idea that they need veneers and they want veneers. But sometimes that's not the case, right? A lot of things that happen there is that probably their teeth are a little bit crooked, right? And we can't compensate veneers with that. Or if they're missing teeth, they want veneers as well, right?
Yeah, that's not possible to breach the veneers. So in that case, if you have a missing tooth, so we must do a 3-unit breach, and then the rest of the teeth will need crowns, not veneers. We cannot combine, for example, veneers and crowns, and to give something more, a
better solution for the problem.
A better solution, yeah, for the problem will be just the crowns instead veneers, because most of the patients comes here and say, okay, I want veneers. I know they want it because they saw some cases that they are beautiful, but to have veneers, the teeth needs to be almost perfect. So it's just to give them a better looking, but we cannot correct positions, as he said.
Not a better function, but aesthetically better.
Exactly.
You know, that's crazy, because I've seen videos of people that are missing teeth, and they said in different clinics that I've seen advertised in social media, and then now they got veneers and now their problems are fixed. But I'm like, you can't do a bridge with veneers.
It's not possible.
So then it's not veneers, it's crowns, perhaps it's Emax, perhaps it's zirconia, because now they're getting extremely aesthetic.
Right.
But patients believe that, and they feel that that's something that we have to do, and that's something that cannot be done.
Right.
Yep.
So a little bit about that. I experienced something not too long ago here at the clinic, when somebody came in and they had a lot of cavity and their teeth were very grinded down, and they wanted us to use fillings to fix the problems.
Yes.
So what do you guys think about it? How does that work? I mean, for everybody that's out there, what do you guys think?
Well, it happens a lot. It happens a lot where, as you mentioned, their teeth are really broken down, and they think just with fillings that they're going to solve the problems. Pretty much, fillings solve very minimal problems, right? You cannot use a filling to reconstruct a whole tooth because it's going to chip off, no matter how good the filling actually is, the composite, right? So we got to talk to the patients. We actually got to show them how they look. We got to talk to them first, right? What they want, what they've heard, what they believe in, and show them sometimes the harsh reality of what's actually going on and what they need.
That's the hard part. That's the hard part, because they said, well, I seen it online and it's possible, and it's really not possible.
Yeah, not all what you see online is possible.
That's
we
exactly
saw
right.
In general, we see a lot of things on internet or on the TV, and we want to be like that, or we want to have something like that, but that's not possible every time. So there's some kind of temporary work that some dentists do sometimes when they do all of them, all the teeth, like not bridges, like it's the composite temporary mock-up. And some people just think that it's permanent, but it's not. We need a space in between the teeth unless we have a bridge, and we cannot. But all the crowns need to have a space to floss it and clean them. So probably the people who have that idea, they saw that, and then they just want to have something like that with veneers or with porcelain, but it's not possible.
Right, and that's the thing, right? There's a difference, a huge difference on what's possible, right? Because you can do it, but what actually works.
Exactly.
Right, and a lot of all the work that we do here at Supreme, we have a warranty. We guarantee that it's going to work. So that's why we don't offer something that's not going to work, that in the first 6 months, in the first year, it's going to start to break off, right? That's why we don't offer that. We're going to go for the things that actually work.
Welcome to Dental Facts. Did you know that people spend around 38 days brushing their teeth? You heard it first at Supreme Dental Podcast. Floss, brush, and keep smiling.
Actually, I follow numerous dentists on social media, and one of them that I follow is in Colombia, and everybody likes this dentist. This dentist has helped people in the music industries, big rappers, a lot of people, a lot of patients, right? But I've never seen a patient say, hey, you know what, my teeth are going strong a year or 2 years after. They use a lot of composite veneers, composite. And they look pretty dull, so it's like a white tooth. It's like a milky white tooth like this. And there's no translucency, it's just white. And I mean, if that's what the patients want, I mean, it is what it is, right? But they don't talk about stains, they don't talk about, how that's not the best type of veneer to use for the patient. But it's probably the cheapest to use.
Right.
So we go back to patching, like you said. Veneers are used for patching. Fillings are used for patching, for solving small problems. But it's not to replace what you have. It's not to. It doesn't work out how a lot of patients think it will. So that's one of the things that we encounter here. Another thing that we encounter is also, one more time, reality versus expectations, right? They say, I don't need a CAT scan to get an implant because I know I got bone. I just took an x-ray and you can see bone, so why can't you just place an implant? Well, because I don't know the size of your implant.
Exactly.
How am I supposed to, what do you guys think about that? Because all these patients, a lot of the times we have patients that are really, really smart about how they research. We have patients that they go in, and the first video that they see, they believe it 1,000 times more than they will believe any type of dentist. And we get that a lot here because we are in Mexico. So even though our doctors are ADA international members, even though we have 7 accreditations, international accreditations, which is more than any other clinic in Mexico and a lot of other clinics in the United States, they still believe the 45-second video that they seen at home. So you guys have those patients that sit in the chair and they tell you, this is what I want, this is what I need, and this is what you're going to do. So what do you guys do? I'm a patient. I sit down in your chair and I said, I want a full mouth. I want white, shiny teeth. I want that Hollywood smile. But my teeth are loose.
Yeah, that's part of our work every day. So we need to convince the patient, but with the truth. So we cannot lie to them.
It's facts,
with
yeah.
Facts. As we have to send them to get a CT scan. We can see how much bone do they have, the conditions of their mouth in general, and most of the times they have a as we are talking right here. So they have false expectations or false or wrong information about the treatment, and we must tell them the truth and tell them what is the better for them and for the treatment. So if the teeth are loose in general, we cannot crown them. We cannot put crowns on losing teeth. So we tell this in another videos probably, but it's not possible. So in those cases, the patients get to the clinic and wants full mouth restoration, but the teeth are moving, so we cannot do it. We're not gonna do it. Someone probably in another clinic will do it for sure to get some money out of them, but that's not our way to work. Right? That's not our style. So we're not that kind of people. So we're gonna make the best for them. So extract the teeth, place implants, and then do an all-on-4, or the opposite. So they want an all-on-4, but we realize that all the teeth are in good conditions, the bone, the gums, the teeth. So we're gonna save them, and it will be a better solution for them. So this is what we do.
Yeah, I think what Dr. Joel is correct. Sometimes, unfortunately, we have to reject patients because what they're asking is not doesn't match with the reality of what's going on, right? And we're not gonna do a procedure that we know it's gonna fail, and then we're going to have a bigger problem than what we actually had, where we had the patient pay money, right? And something that we know it's not going to work. So we don't work that way.
See, not just that, is also, I mean, you guys went to school. You guys taken many courses. In Mexico, you guys taking courses. In Argentina, you guys taking courses in Spain. You guys can't go against everything you guys believe, and you guys know it's right, because even though they're asking for it, they might not know what's really good for them, you know. So it's we see it all the time. Like I said, we're not order takers. And you know what's crazy is sometimes patients come in and they say, you know what, I want an all-on-4, and I want the top of the line, 18, 19, 20,000, whatever it is, and we're like, we can save your teeth with the full mouth restoration, and it's going to be 9,000 or 9,800. So it's not, oh, they're doing this because of the money. They're doing this because it's the best treatment for you.
Right.
So they did it many times. Yep. So not all the times. If you pay more, will be better for you. It needs to fit on your and your diagnosis and the best for the patient every time.
Yeah, and we believe that saving teeth is always better than having implants, for sure.
Yeah, there's nothing like having your own teeth.
Right.
If they're savable.
Right.
Yep. If they're not savable, then implants is the best option.
Yeah, because that happens a lot, right? A lot of people see their teeth and they're like, well, my teeth doesn't have any cavities, right? But we have to take in considerations the gums and the bone. It all completes just one structure. Some people, hey, well, my teeth don't hurt. Yeah, but the foundation on what they're on,
functionally speaking,
yeah, it's not there anymore. So sometimes, either because of cavities or because of their gum issues, periodontal issues, we have to extract the teeth. Sometimes the teeth are good, but the gums are bad, and the teeth don't work properly because the gums are bad. So we have to extract and place implants.
So it's like periodontal. What was it like? It's like a silent death.
The silent death.
Yep. It's like they don't feel it, and all of a sudden their teeth start breaking, and they're like, "What's going on? My teeth look great."
They start moving,
or they start moving and lose them.
That's pretty crazy. See, and that's a lot of reality versus expectations that we get. You know what I've even seen on social media, and I've actually been wanting to order this. It's like you get it and you put it on, and you got a perfect white smile,
right? And
you can tell that the person that before they put it on, somehow, some way, when they put it on, it's actually either veneers or something, because they look so natural and so thin. And then I seen another one where it looks like one of those vampire teeth that you put on for Halloween and stuff. So and patients see this, and some patients say, "Oh man, why am I gonna go pay hundreds, thousands of dollars if I could just order this for $20.99 and and fix all my problems?"
Right.
Yeah, I used to tell our patients a lot when I was out in the field floating around, talking to our patients and seeing different things. I still do, but before I used to be always in reception, because I was actually part of the reception, and I always used to say, if it's too good to be true, if it sounds too good to be true, it probably is. If somebody could just fix the pain with a filling, or they put a fillings on neck of the teeth. You know, you could see like on their gum line, like how their gum goes all the way down, and they just want to patch it right there.
Right.
Yeah.
And you're just like, oh no, man, it's not gonna work out. And they're like, oh no, it's been done a lot of times. And you're like, oh, I don't want to do it. You know, you're better off going back to wherever you got it done. And some patients say, well, what? I remember a patient told us, well, you don't want our money? By all means, you know, this is a business, but we can't do something that we know it's wrong.
Exactly.
Yeah.
Because that goes against everything that we believe in.
And it's only going to get us into problems. And we don't want that.
That's another one, yeah. So what about implants, guys? What about the patients that come in and they say, you know what, pull out all my teeth. I want implants. I don't want to deal with teeth anymore. They don't understand how, in reality, they still got to go to the dentist.
Right.
In reality, they still got to keep them clean. In reality, you know, there's a lot of, they won't be able to eat the things they were eating before because now they have, even though it's over implants, it's still not theirs. You know, it's still not, it's like me having a metal leg, a titanium leg. I can walk with it. I could probably run with it, but I can't go squat with it because I'm going to break it because it's not meant to squat. You know, these prostheses are not meant to eat corn on the cob or rip into a steak and just rip it off.
Right.
That's a very good example about the metal leg, because when the people has implants, they cannot like chew normally 100% because they don't have ligament, they don't have nerves. If you put something in between your upper and bottom teeth naturally, something hard like a rock or like a bone or something, you're gonna bite down and you're gonna feel it. You're gonna hurt, and so right away you're gonna release.
Stop.
You're gonna stop and release. So when you have implants, they don't have that sensation, and they can chew and bite down hard until something breaks. So they don't have the sensitivity.
They can't measure their strength of their bites.
At the beginning, they have to be very careful and
Yeah.
start chewing something soft until they get used to it. Their brain eventually gonna do it. Gonna measure the dimensions of the bite.
You know, it makes sense because we've been doing a lot of immediate loads, and with immediate loads, we tell our patients, be careful, and then they're careful
They
for
don't.
about a week or for 2 weeks,
Yep.
and they're just like, the dentist is just,
Yeah.
they're just overreacting. I'm gonna go eat a corn on the cob. Boom, there goes a tooth.
Right.
I mean, it's not their final work, but it's something for them to get accustomed to what it's coming.
Yep.
And they can't stop the bite, like you said. They don't know how hard they're biting, and now it breaks off.
Right.
Yeah. So
Wow.
it happens.
Yeah, it's a lot of muscle memory. We tell our patients that the first month that they have to think about the way they're actually chewing, because as Dr. Joel mentioned, there's not the receptors that receive the pressure anymore, so they really don't know where their jaw is located, so they have to take time. What I've also seen is a lot of people that come down and they want to get crowns, right? Because they saw on TV that they get crowns. And I had this situation this week. The patient, he only had 2 teeth left in the bottom, and he had 7 teeth left in the top. But there was a lot of bone loss. Only 1/3 of the root was actually attached to the bone.
Wow.
And he wanted crowns, right? And it's very difficult to talk to that patient and to tell them that, you know, that
Make them believe.
It can't be done.
Yeah, that it cannot be done.
And the thing is, I've seen, and not just in Mexico, I've seen people that come from the United States or Canada, and they have like the longest bridge. They have like this 10-unit bridge or 14 units grasp onto like 4 teeth, 4 natural teeth. And you're like, who did this? You know, obviously those teeth are going to get loose.
Right.
It looked nice in the beginning. It's like building next to the lake, and your house is, you know, there's no foundation down here, but it looks nice, but the house is going to start coming down until it just flips. And that's what happens. And then they come back and they say, can I just re-glue it?
Right.
Yeah.
And you're just re-glue what? You know, can I just re-glue this humongous bridge that was done incorrectly? No, I can't re-glue it.
Right. Then one of the teeth breaks. You know, they have 3 left.
And they like customize it.
Yeah. Yeah. There's a lot of biophysics that goes on. It's not just teeth, right? There's a lot of math that goes into this.
I think the key thing is explaining to someone that doesn't want to understand. Like if you're explaining to someone why you can't do it, but they don't want to understand it.
Right.
It's like in Mexico that says there's not a worse blind person than the one that doesn't want to see.
Yep.
because the people that are blind, they walk around, they're reading, you know, they're doing, I mean, obviously they're touching things, but they keep on going. And these people that don't want to see the reality, obviously they got their expectations. That's the ones we got the most problems with.
Right.
We just had a problem not too long ago with someone who was arguing why a cleaning, and we were just talking about this before the podcast, why their friends had paid $30 for a cleaning, and how come they were getting charged $200, but it was a deep cleaning.
Yep.
It wasn't a normal cleaning.
Right.
And they were going at it with the receptionist. And that's the things that I don't understand. I feel that sometimes when patients come to different parts of the world, they expect different things. Obviously here, I love when somebody comes in and we turn their smile from something they were ashamed to something that they love, you know, and they walk out and they're just like, I'm ready to face on the world. Or like that patient you had that, well, you guys had so many patients, but the patients you had that he was like 70 something years old, and he didn't have any upper teeth for like over 18 years or 20 years. And then you did an immediate load.
Right.
And he was like, wow, like I haven't had teeth for a long time on the upper.
Yeah, it's him.
You know, or that video of the patient when he sees his smile and it captured on one of our cameras, and he looks at it and he just starts crying, and you don't know what to do. You're just standing there. You're just like,
probably just, you
touch them. You're like, it's okay, you know, and he looks at it again and he starts crying again. And though, I mean, obviously we all like a happy ending, but not all the time. One more time, you know, what they expect versus reality.
Right.
Not all the time is that, you know, not all the time is that. And we do get patients that say, I want a full mouth restoration. I want all crowns. And they come and their teeth are loose, or their bone is very diminished, or they have periodontal disease, or 1,000 other things. And you're just like, look, if I do crowns, your teeth are going to fall out even faster.
Right. Or sometimes when they have their lower jaw bigger than their upper jaw, right? And they have a cross bite where they bite like this. And they believe that with the full mouth restoration, we can correct what skeletal problems, right?
Yeah, that is just needs to be solved with a surgery. They need to cut a part of a jaw and put it back. And then it's a very big surgery. It's a very big deal.
It's a big process.
So we cannot solve that. Not even with implants, not even with crowns, not even with nothing like that.
Wow.
Yeah, so there's a lot of explaining, but the good thing here is that our clinic, we have the cameras, we have the intraoral scanner, we have the CT scan, we have all the technology to be able to show them what's actually going on in a way that they can fully understand. We could do smile makeovers. So that's a lot of the tools that we have here at the clinic that helps us explain to them at full detail what's going on, what's possible and what's not possible.
Well, no, that's very, very important. No, well, thank you so much, guys, for coming. I appreciate that. Like I said, we can go on and on about, there's so many different little things here and there that we see that is expectations versus reality. But in reality, we're going to do what's best for you. In reality, we're going to do what we know it's going to last the most. We know it's an investment. We know a lot of you have saved for a very long time. We have patients that said, I've sold my house to be able to get my smile back. You know, I people that walk in, they've lost a significant other and they just want to smile. They just want to eat, you know, and that's the reality. We got to give them the reality. Sometimes it's not the reality they want to hear.
Right.
But it's the reality that is going to better fit their needs. But thank you so much, Dr. Elias. Thank you so much, Dr. Joel, for coming. Thank you so much, guys. Like I said, we appreciate you guys. Any questions, concerns you guys have, let us know. Don't forget to like and subscribe. This has been Expectations versus Reality. There'll be a part 2 for sure. Have a good one. Bye-bye.